Hello, hello, and welcome to Seven Sentinels. This is Grandmaster class, and I'm Peter Simon with you. Today, we are going to study this letter, Mr. Harrison Mason, right-sided heart failure. So get ready, try to learn some new things. So this is the case. So this is the beginning. Just go through the case. We are going to learn how to make sentences, quality sentences. Yes, good evening, Neha. Good evening, Pranita. Good afternoon, Manjula. Yes. Now let us see how we are going to. I will ask you some questions and you have to follow up. Okay. Now, first one is, now here you are a nurse working in a cardiology department where Mr. Mason was admitted. Yeah. So admitted. Yeah. So that's the point. Now, assessment is right-sided heart failure. Right-sided heart failure. Right-sided heart failure. Right-sided heart failure. Then next. So this is the plan, discharge plan. Yeah, good evening, Suma. And here is the writing task. Okay. Here is a writing task. Using the information in the case notes, write a letter to Dr. Donald Marshall, physiotherapist, making a request for starting pulmonary rehabilitation program, weight reduction, and advice on healthy diet. So this is the point. What is the type of letter? It's a referral letter from a nurse to a physiotherapist. Referral letter from a nurse to a physiotherapist. Okay. So now let us see very carefully here what is important. And the first one is, you are a nurse working in the cardiology department. And Mason was admitted, means it is inpatient ward, cardiology department. Okay, registered nurse. So registered nurse, inpatient ward, cardiology department. The name of the patient is Mr. Harrison Mason, and date of birth is given. This is the date of birth. And his age is 69. So whenever you have to write 69-year-old, you have to write like this. And he's a widower. Right. He's a widower. Then next. Right. Assessment. That is diagnosis. Right-sided heart failure. That is the diagnosis. And you are writing the letter to Dr. Donald Marshall, physiotherapist, Frankie Street, New York. So, and you are requesting for commencement of pulmonary rehabilitation program for commencement of pulmonary rehabilitation program number 1, weight reduction exercise number 2, and number 3, advice on healthy diet. So these are the things which are very important. So now I'll teach you how to transform the case notes, okay, by not using any words from here, as far as possible. As far as possible. Yeah. So from here, first one, write the address. Write the address first. So now let us take the address. Address you will take from here. Right. Everything we'll consider today. Everything. All inclusive. Right. So this is line number 1. Line number 2. Line number 3. So here, line number 4. Something is missing actually. Right. The name of the physiotherapy is missing. Hospital physiotherapy. Okay. Right. So, Dr. Donald Marshall, that's fine. Physiotherapist, fine. What is the name of his center? We don't know. It's a direct street in New York. So we don't know anything about his clinic or hospital or whatever it is, a center, physiotherapy center. We don't know anything, so that is missing. Otherwise, everything is perfect. So, Dr. Donald Marshall. Okay. Dr. Donald Marshall, physiotherapist, Frankie Street, New York. So that's it. This is the address. This is the address. Right, that's very fine. Number 1 is the address. So this is the first part. That is the address. Right. That's done. So now second one is the date. So date 14/1/2021 as medical records. 28/12/9. So this is the date. So today's date 14/1/2021. 14/1/2021. So that's the date given here. That's the date here also. Cardiology department. Right. Admitted. So inpatient. So date is 14/1/2021, 14/1/2021. Yeah. So date of admission, date of discharge, nothing is given. He was admitted and maybe same day discharged. Okay. So date. So 28, then January 19, 2021. So that is the date. Number 2. Number 2. So date of admission and date of discharge and everything. So that's number 2. This is the date. So next one. So next one is the salutation. Salutation. Yeah. Salutation. Okay. So next number 3 is the salutation. Number 3 is the salutation. So it starts with doctor and marshal. So it should be dear Dr. Marshall, comma, dear Dr. Marshall. That's it. So this is number 3, the salutation. This is number 3, the salutation. Number 3, salutation. So follow this style, same style. Follow it. Okay, next 4th one is, yeah, good evening, Meera. Good evening, Suma. Yeah. 4th one is subject line. Subject line, you will go here. Mr. Harrison Mason, date of birth. These are the 2 things. Yes, good evening, Raquel. So, number 4. Number 4. We'll take number 4. Number 4 is the salutation. or the subject line. Fourth is the salutation or the subject line. Okay. Right. Salutation or the subject line. Fine. So we'll take this one. Regarding, colon, immediately. Mr. Harrison, no full stop, no comma, nothing. Harrison, Mason, comma, D-O-B, capital letter, colon, immediately, space, 28 December 1953. 28 December 1953. So that's it. Yeah. So, fourth one finished. Now, after this, step by step, we will see each and every paragraph, sentence by sentence, and I'm going to show you how you can avoid writing the same words which are there in the case notes. How to avoid those words. So, fifth one is the body of the letter. So, fifth one will be the body of the letter. Okay. And fifth. The body of the letter. So this we'll see in 5 paragraphs. 5 paragraphs. Okay. So next, sixth one. Sixth one is the closing remarks. Salutation, closing remarks. Sixth one will be the closing remarks. Sixth one will be the closing remarks. Sixth one will be the closing remarks. So yeah, closing remarks. Now here, dear Dr. Marshall, name of the doctor is there. So what are you supposed to do here is you have to say yours sincerely, comma, yours sincerely, comma, yours sincerely, comma. Right. So if the name is not there, dear doctor, dear nurse, dear supervisor, dear manager, then you have to write here yours faithfully. Yours faithfully. So far, so good. Now, number 7. Number 7 is the sender's particulars. the sender's particulars. So who is writing this? Who is writing this? This will take up. So here it is, the sender's particulars. So the sender's particulars here. Right. Now we know that nurse, registered nurse, RE, registered nurse, inpatient ward, cardiology department. Yeah. So that's so we have got all the other counterparts other than the body of the letter. So now we can go for the main course. The starters are over, the desserts are over, and now we can go for the main course. So far, everything is clear. Everything is clear. So, any doubts? If you have any doubts, okay, then let me know. If you have any doubts, let me know. Yeah. Just to give a word, yes or no, so that we can move forward fast. I'm giving you 10 seconds. If you have any doubts, you can ask me straight away, because we are going into the main course and I'm going deep into the subject by transforming the case notes into the standard presentation format. We are not going to use majority of the words which are there in the case notes. Yeah, just be generous enough to write one word, yes or no. I'm just asking one word. Yeah. So Suma Maria, Neha Naveen, Meera Manoj, Chaitra Gowda, Deepika, Pranita, and Neena. No. So these are the very serious students. Others don't even want to say yes or no. That's fine. It's okay. Right. So Sahaya Vinoka, very good. Thank you. Thank you all of you for giving your response in a word when asked. That is what is obedience. Obedience is very, very important. This is how you prove that you are very obedient. You are really serious. Okay. Right. It makes you feel, you know, somebody is giving half an hour lecture and is asking to give one word, and you are not ready to listen to one word. That means you don't deserve the quality which is given. It's okay. Yeah, that's fine. So, if anybody of you is here, half-hearted people, just you can go and enjoy your time. Don't waste your time here, please. Okay, all right. So we got all these things. Just to recapitulate. Just let us recapitulate what we have done. First one is the address. Address is here. 4 lines address. We got it in 4 lines, address in 4 lines. So Dr. Donald Marshall, physiotherapist, Frankie Street, New York. All the first letters of every word should be capital letter. Remember that. This is a rule. This is a rule. Yeah, good evening, Shabnam. So this is a rule. Next, number 2. Next one will be the date. 28th March 2021. That is the date. So leave one line between address and the date. Then write the salutation, dear Dr. Marshall. Number 3, leave one line again. Then again leave one line. Then write the subject line regarding Mr. Harrison Mason, date of birth 28 December 1953. Oh, space. Space is needed here. Yeah. So space is needed. 28 December 1953. Right. So that's done. This is number 4. Then number 5 is the body of the letter. The body will you write in 5 paragraphs. We'll discuss that one now. Then next one, 6th, is the closing remarks. Yours sincerely when the name of the doctor is given. And just a doctor, then you have to write yours faithfully. Then next, sender's particulars in the beginning. Registered nurse, inpatient ward, cardiology department. We don't know which hospital and all these things. Okay. Yeah. Right. Now the problem. So patient right-sided heart failure. Right-sided heart failure. Right-sided. It should be hyphenated. It should be hyphenated. Hyphen is missing here. Right-sided is hyphenated. Right-sided, whenever you write these words, right-sided, okay, and left-sided. Right-sided, left-sided. So write with the hyphenated. Yeah. Yeah. Right-minded, right side, right side, right side. So hyphenated, right-eyed. So, right. So try to give left-sided, right-sided. Okay. Left-sided. Left-handed, left-brained, okay, left-eyed, okay. So they are hyphenated. Fine. Next. Yeah. So this is how we go. Now, next one is the purpose of the letter. The purpose. For starting, 3 things. It requires 3 things. Number 1 is rehabilitation program. It requires rehabilitation program. Number 2 is weight reduction. Number 2 is weight reduction. Number 3 is healthy diet. Okay. Write a letter to the physiotherapist. So for starting, physiotherapist. Okay. You have to make a request for starting pulmonary rehabilitation program, weight reduction exercises, and advice on healthy diet. Okay. So all these things. So healthy diet dietitian can give, but exercise related, again, physiotherapist. Okay, fine. So which is relevant for the physiotherapist that you have to take. So requires pulmonary rehabilitation program. Yeah, lot of irrelevant information is there. You can avoid them. Right. So this is the plan following the discharge. Following the discharge, what should be done? So weight reduction is given here, weight reduction. Okay. Then pulmonary rehabilitation program. Yeah. So what all are required here? They are explained here. And next one, healthy diet. And this is diet. This is diet. So weight reduction is there. Weight reduction is there. Diet is there. And pulmonary rehabilitation program is there. So these are the things which we have taken. So we can write all these three things in the introduction and focus on the things which are required for the physiotherapist more on the physiotherapist points. What are required for the physiotherapist? Fine, remember. Then, so 1, 2, and 3. And this is a referral letter. So he has mentioned here it's as a referral letter to a nurse. Right. So now the patient is here, Harrison Mason. So start with Harrison Mason. Don't write, I am writing to request, I am writing a letter, I am writing this referral letter to you to request. All these things, no need. Okay. So this is all beating around the bush. Unimportant things, not necessary. Avoid them as far as possible. So just to start with Mr. Harrison Mason. So start with Mr. Mason, comma, Mr. Mason, comma, I'll take you everywhere. Mr. Mason, assessment, right-sided heart failure. So who was diagnosed with right-sided heart failure? Okay, Mr. Mason was diagnosed with heart failure, or yes, comma, is being, okay, so is being referral letter. It is a referral letter. Referral letter is being referred for. Is being referred for. You have to go everywhere. You have to find what information is where. Is being referred for. what is being referred for the commencement of starting. So commencement, what about if it is commencement? What about continuation? So try to understand. Only to start and leave. Only to start and leave. So not just for starting. Be very careful when you are writing something. If you are starting, then what about the continuation? So eliminate the word commencement or starting. Okay. For pulmonary rehabilitation program, comma, weight reduction and weight reduction exercises and recommendations, advice, recommendations or action plan for healthy diet, healthy dietary regimen, healthy dietary regimen. Yeah, following the discharge, physiotherapy, Frankie Street, New York. Discharge, is he going back home or is he going to somewhere else? So physiotherapist is going to take care of him. Okay. So yeah, lives alone and has a cat at a Budgerigar at home. And a Budgerigar has hypertension, lives alone at home, lives alone. And he gave up 9 months ago when his first grandchild was born. He lives alone. Yeah. So his discharge where and back home. Information is missing. So this is a physiotherapist, and the physiotherapist will visit him personally at home. Pulmonary rehabilitation program, weight reduction. Okay. It may be at his office, they will go, or the doctor will go to home. That's information is not very clear. Okay, following the discharge today. So we don't know whether he's going back home or to his facility. All right, that information is not given. So information is not given. So then you can take it for granted that it is going home. Discharge back home today. Yeah, that's it. So Mr. Mason, who was diagnosed with a right-sided heart failure, is being referred, or you can say who has been recuperating after, okay, a stroke or whatever it is related, you can just assess that one and write. So who was diagnosed with or recuperating after a right-sided heart failure is being referred, okay, home today, fine. That's how you can write the introduction. Yeah. Where can we put this? Okay, right. So here is one point. So this is the way how you can write. The next one. So what you want to write. Now let us see, introduction is over. After surgery, from or after recovering after surgery, but this is not surgery, right? We don't know whether it is surgery. Left-sided stroke, but admitted, no discharge, but there is no mention about any surgery. Is there any mention about surgery? Yeah, you have raised a question that so recovering after this occasion, okay, recovering from some problem, recovering after, okay. If it is a disease, recovering from. If it is some problem or some surgery, recovering after. Recuperating after, recuperating from. Yeah, recuperating after surgery. If surgery is there, diagnosed with or recuperating from a disease, but after a stroke. After a stroke, not recuperating from a stroke. Recuperating after a stroke. Stroke happened, finished. After that, recovering. So that's it. So after a stroke or after a surgery, that's fine. But from a disease, when you say recovering from, you have asked a very good question. Recovering from a disease, but recovering after an occasion or surgery. So that's it. So this is the way how you can use. I hope I have clarified your doubts. So because this is not a disease, right-sided heart failure is not a disease. It's an occasion which happened one particular minute. After that, he is recovering. So from a disease, he is recovering. That is it. So this is the way how you can use these connotations. This is called collocation. Collocation. So I did not see anywhere surgery or anything, right? So that's why I did not mention surgery. Okay? After a stroke, he got stroke, and after that he has been recovering. Yeah. So next one. Yeah, good question. The next, now here we are going to write conclusion. Conclusion we'll write in the similar way. Body paragraphs we'll write in 3. So upon admission, then during hospitalization, and discharge plan. These are the 3 things which we have to write. What are the 3 things? So A, 3 paragraphs, 3 main body paragraphs. A is upon admission. Upon admission, or number B is during hospitalization. C is upon discharge. So this is discharge plan. Okay. Sometimes when some other things are there, histories are there. So you can write about the histories first. Okay. You can write about the histories. Social and family and medical history. All these histories will go into first paragraph. Okay. Then admitted. When he is admitted, what happened? So this is upon admission. Okay. Then this is management. Management during hospital stay, hospitalization. And this is discharge plan. So now what you can do is the social, family, and medical history you can write. Okay. If it is important, but is it important for a physiotherapist? He worked as a warehouse man until he was 65. Became frustrated. Yeah, this is okay. Patient is not able to look after his grandchild because he feels too short of breath. No other relevant medical or family history. No family history is there, no medical history is there. Okay, lives alone and has a cat, and so is this necessary? So try to understand what is relevant and what is irrelevant. He has hypertension for the last 6 years and AF. What is this AF? For 10 years. AF. AF. Hypertension HT. AF. AF. Medical term. Atrial fibrillation. Atrial fibrillation. Not arterial, it's atrial fibrillation. Okay, fine, no problem, we can learn. AF, atrial fibrillation. Yeah, I know that one, but I'm not sure because I have never seen as short form so far. So atrial fibrillation, 10 years. Atrial fibrillation, 10 years. What is this atrial fibrillation? He has hypertension even now then, 6 years. And atrial fibrillation, 10 years. What is this condition? Is it prolonged condition? Irregular heart rate. Okay, fine. So for the last 10 years and 6 years respectively. Okay. So is this related to physiotherapy? Is it necessary for physiotherapist to think? It is necessary, you write. His GP gave him salbutamol meter dose inhaler, which produced no improvement in his symptoms. Is this necessary for a physiotherapist? So think what is necessary. Now, I want to ask you, I want to participate. So doctors participate more. Definitely you have to participate. So Fahmida Khatun, then any other doctors here? Only one doctor is there. Shabnam left. Okay. So any other doctors are there? Right. So respond actively, please. For the questions which I am going to you, relevant or irrelevant? We'll take the majority vote. We'll take the majority vote. I'm 0 here. Think like that. We'll take the majority vote. For the physiotherapist, is it required means I'll say yes. If it is not required means I'll say no. Required, not required. These things you have to suggest me. He worked as a warehouse man until he was 65. So this is the point. Point number 1. So we'll take this as point number 1. Point number 1. Yeah. 2, 3, 4, 5, 6, 7, 8. So that's it. 8 points are there. 1, 2, 3, 4, 5, 6, 7 only. Sorry. 7 points. Yeah. There are 7 points. Now I am giving you point number 1. Point number 1. Yes, point number 1. Is it relevant or irrelevant? Relevant means R. Irrelevant means I. Okay, give the majority vote. What do you think? Is it relevant or irrelevant? All of you give. Be free. Okay, what your heart says you give. Okay. Come on, all of you participate. If you cannot decide now, how can you decide in the exam? Can't type even one letter. If I cannot make you write one letter, it's a shame for me, not for you. That means I am not a very good, excellent teacher for you. So many students said this is relevant. Yeah. So that is it. Relevant. First one is relevant. Then next, point number 2. Point number 2. Yeah. Became frustrated by his inability to do what he used to do. Is it relevant or irrelevant? Don't be influenced by your others. You write your own. Majority I will take. That's all. Come on, fast. Don't waste our time. Time is very precious. So that is relevant. People say. Okay, majorities have said that. Okay. Next point number 3. Yes. Patient is not able to look after his grandchild because he feels too short of breath. Is this relevant, you think? Then write R. If it is irrelevant, is it relevant to the physiotherapist? Write R or I. Don't write anything yes or no. Majority what we will take. That majority is the winner. That's all. There is no question. Okay. So majority says it is irrelevant. Okay. Next. Point number 4. Yes. No other relevant medical or family history. So is it necessary? Is it necessary to say that he doesn't have any medical history? He doesn't have any family history. Do we need to say if there is not no history? Don't say that's it. Yes. So people say it is irrelevant. Yeah, of course it is irrelevant. I don't need to say that I don't have headache, I don't have chest pain, I don't have body aches, I don't have back pain, I don't have cold. What do you have, you tell me. Why are you talking all this nonsense? I don't need. Tell me what you have problem. So point number 5. Lives alone and has a cat and a budgerigar at home. Lives alone and has a cat and budgerigar at home. What will the physiotherapist do with his cat? What will the physiotherapist do with his budgerigar? But here he lives alone. Okay, right. So majority vote is point number 5, irrelevant. So this is how we learn things. This is how we learn things. Point number 6. Okay. Yeah, point number 6. He has hypertension for the last 6 years and atrial fibrillation for the last 10 years. Is it related to something physiotherapy, atrial fibrillation? Then you write atrial fibrillation is a condition that causes an irregular heart rate. Okay. And hypertension. So is that related to physiotherapy anyway? Just check it. Reason yourself. No problem. Give your choice. There's absolutely no problem at all. Yeah. Come on, give some more. Majority are saying relevant. Okay, that's good. Yeah, relevant. Then next one. Point number 7. Point number 7. His GP gave him a salbutamol metered dose inhaler, which produced no improvement in his symptoms. Is this required? His GP gave him a salbutamol metered dose inhaler, which produced no improvement in his GI symptoms. In his symptoms. No improvement in his symptoms. Yeah. So majority said it is irrelevant. You're done. So these are the things. Right. That's fine. So this is regarding social and family history. Right. So next one, his medical records. So this is admission, and this is examination, and this is hospital stay. So now let us join this. Okay. So we can write 4 paragraphs, or you can write 3 paragraphs. Admission and yeah, hospitalization 1 paragraph, and you can include yeah, this into 3rd paragraph. No problem. Yeah. Now let us see medical records. Presented with a cough with daily sputum production for the last 20 years. Yeah. So this is, we'll take this one as ABCD. Okay. We'll take them as A, B, C, D, E. So 5 points we can take. So A, B, C, D, E. Okay, fine. So 5 points. Which is relevant, which is irrelevant, you think? So point number A. Point number A. Presented with a cough with daily sputum production for the last 20 years, has become short of breath over the last 3 years. Yes. Is it relevant or irrelevant? Ranita, relevant, no need to write. Just write R. You wrote a spelling mistake. Yeah. So next, point B. Point B. So many people said relevant. Okay. Right. That is relevant. Okay. Next, coughs up a little white or yellow sputum every morning. Coughs up a little white or yellow sputum every morning. Okay. That's done. Very good. Next one is point C. Point C. Loss minimal weight recently. Weight loss. Minimal weight loss. Now weighs 100 kgs. Now weighs 100 kgs. Minimal loss. Now weighs 100 kgs. Yeah. So relevant. Okay. So next point D. Ankles became swollen recently. His exercise tolerance has decreased. Highly relevant. Yeah, very good. So if we analyze like this, it will be easy for you in the next lectures. Next. Point E. Patient can no longer carry his shopping back from the supermarket 100 meters, 180 meters, 200 yards. Patient can no longer carry. Earlier he used to carry his shopping back from the supermarket. Backpack or bag or I don't know what shopping back from the supermarket. He's going to the supermarket, from there he has to back carry them. He's not able to carry. Is it relevant or irrelevant? It is related to his strength, tiredness, strength, physical action, physical exercise. Okay. He wants to carry. Is not able to do any physical activity. That's what it is. Okay. Come on, all of you. Just type R or I. Majority vote will take. That means his body is very weak. So he has to regain strength. That is why we have. Oh my God, it is raining again. Yeah. So is related to physical exercise, normal routine exercise. Okay. Is normal routine exercise. Exercise is related to physiotherapy. So his body is not strong. So right now, let us go to overweight. We know already his weight. Already it is there. This is highly relevant. It is highly relevant. Highly relevant. The next one, all these points. Okay. This is okay. So upon admission, everything was inquired based on the records. Next one, examination. Okay. So cyanosed has signs of right-sided heart failure. Cyanosed. Now, what is this cyanosed? Cyanosis is a pathological condition that is characterized by bluish discoloration of the skin or mucous membrane. The word cyanosis is a derivative of the word cyan, the blue color, blue-green color. Okay. Bluish green, bluish discoloration, skin or mucous membrane. Okay, fine. Blue or gray skin or lips. Cyanosis happens when there is not enough oxygen in your blood or you have poor blood circulation. Can be caused by a serious problem. So, fine. So, he is cyanosed, has signs of right-sided heart failure. So, this we can take as the points P, Q, R, S, T. 5 points. P, Q, R, S, T. We will take them 5 points. P, Q, R, S, T. So now let us take the point P. Is it relevant or irrelevant? Yeah, majority of you have said relevant, but yeah, I go against it. It is irrelevant because this color is not related to physiotherapy and has signs of right-sided heart failure. We already talked here in the introduction. So this again, no need repetition. So it becomes irrelevant. If his cyanosis is irrelevant but has signs of right-sided heart failure is relevant. This part is relevant. But we have already discussed. So this also becomes irrelevant now because if you repeat it, it becomes redundant. So no need to repeat this one because we have already discussed assessment. So the same thing is going again. So repetition it will become. So no need to tell. Otherwise it is relevant. Okay. Otherwise it is relevant. So this becomes irrelevant. Next one. Point number Q. I have to tell you, no? I have to tell you those things. Point number Q. Patient appears to be centrally and peripherally cyanosed, has some pitting edema of his ankles, edema of ankles. So ankles, edema of ankles. Patient appears to be centrally and peripherally cyanosed, has some pitting edema of ankles, edema of ankles. The swelling called edema is a result of too much fluid in the tissue. Congestive heart failure or the vein not working well, also known as venous insufficiency, is often the cause. Yeah, come on. Point number, okay, 1 second. Yeah, point number Q, that is patient appears to be centrally and pitting edema of ankles. Okay. Then jugular venous pressure is raised 5 minutes. What? This is what you have done in the during hospitalization stage. Okay. Come on. Point number Q. We are still in point number Q only. There are only just a 1, 2, 3, 4, 5, 6. So 3 relevant and 3 irrelevant. What about the others? It is neutral now. Yeah. Edema of the ankles. Swelling called edema. Edema in foot and ankle. Swelling. Is this related to physiotherapy or not? So there may be word count more. Yeah, I agree with you, Meera. But the thing is, there are many other things which I am going to tell you. There are irrelevant and relevant. There are some semi-relevant material also. So those also we are going to deal with next. So swelling, is it relevant? Yeah. So there are some semi-relevant material. We can remove those things. According to the priority, we can take. That's not a problem. Then next. So jugular venous pressure is raised 5 centimeters. So point number R. Point R. Point number R. Come on fast. We're coming to the end now. Jugular venous pressure is raised 5 centimeters. The jugular venous pressure is usually assessed by observing the right side of the normal jugular venous pressure determined as the vertical distance above the midpoint of the right atrium. Atrial fibrillation. Okay. Right. And what is this atrial fibrillation related to? Heart arrhythmia, beat slowly and fast. Okay. Right. So R is irrelevant. Okay. The next one. Patient has poor chest expansion. Point S. Patient has poor chest expansion. Is it relevant to the physiotherapist or not? I'm going to show you how to reduce the word count by using listing if the words are more. No problem. There are many things we are learning. I told you already. So this is relevant. Okay. Right. Next one. Point T. Point T. There are some early inspiratory crackles at the lung basis. There are some early inspiratory crackles at the lung basis. Inspiratory crackles. While breathing, there are some inspiratory crackles. Inspiratory crackles are respiratory sounds often heard in chronic obstructive pulmonary disease, as well as in restrictive conditions such as heart failure, lung fibrosis, and pneumonia. One Borjaks proposed that crackles heard during inspiration were related to sudden opening of airways. Yeah. So this is the reason why he sent to the physiotherapist for doing exercises. Remember that. So he has to be careful. Okay. Sudden opening of airways. So keeping this in mind, exercises should be restricted, controlled, not more strenuous. Not more strenuous. So some early inspiratory crackles at the lung basis. So try to understand this. Right. So this is semi-relevant. This is semi-relevant. So that's, I did not mark that. That's why. So semi-relevant means you can use or you can leave. You can use or you can leave. So those are relevant. I tick marked. Those are irrelevant. I into marked. And those are semi-relevant. I have left like that one. So it is your choice how you want to take. You don't want to take. Yeah. So the thing is plan. Plan is okay. Exercises. Exercises. Continue exercising. Pulmonary related to lungs. Remember that. So this becomes relevant. This becomes relevant. This becomes relevant. Because you are sending him to continue exercising, okay, and then a pulmonary rehabilitation program, motivation to continue exercising. Exercises is important, and this is related to pulmonary rehabilitation program. It is related to lungs. And here, It is regarding lungs. So, because you are not able to decide what is right and what is wrong. So this is very important. Right. So based on this one, you have to give the exercise program. You need not write this, but you have to focus on this rehabilitation program, taking care of this one. You need not write this. You need not write this. Okay. But you have to focus on this pulmonary rehabilitation program to increase exercise tolerance. Exercise tolerance to avoid these things. To avoid these things. Inspiratory crackles. So crackles are respiratory sounds often heard in chronic obstructive pulmonary as well as in this. So these are heard during inspiration or related to sudden opening of airways. Okay. So yeah. So now you can see why it is relevant, and this is semi-relevant, but based on this one only, you have to give this exercise rehabilitation program. Rehabilitation program. So those goes here. Those things go here. This will go into the third paragraph. Okay. This will go into the third paragraph. Right. Or the last paragraph, discharge plan, follow-up action plan. So this should not be written here, but this should be related to the follow-up action plan. In this paragraph, let it come. In this paragraph to manage those things. Right. Next one. These points 1, 2, 3, 4, 5, 6, 7. So ST. Right. This is yeah, double A. This is very important. That's why I'm doubling it. Double B, double C, double D, double E, double F. Why I am doubling is the reason. Okay. Why I am doubling is the reason here, because these are very, very important. Discharge plan, follow-up action is, all these points are important. Nothing can be excluded. This is what they have to do. This is what you have done. Okay. This is what you have noticed. And based on that, this is what action plan you are suggesting. If you don't write these points, no problem, but these points are related to these points. So these are must. This paragraph will be the biggest paragraph. Blood gases should be checked to see if he might be a candidate for long-term home oxygen therapy. All are important. You cannot exclude. You cannot say this is relevant or irrelevant. Everything is relevant. That's why I said doubled. Gentle diuresis might help the edema. So edema. So here it is. Edema of his ankle. Semi-relevant. So then he has to follow up this one. Gentle diuresis might help the edema, although oxygen would be a better approach if he is sufficiently hypoxic. So this becomes relevant. But you need not write here. So this paragraph will go and mix up with this one, because these are your observations. And based on this, you are giving him the recommendations. So this paragraph will be eliminated and it will go into this paragraph. This will be merged into this paragraph. These are your studies. And this is the follow-up action plan based on your studies. Follow-up based on these studies. These are your observations. Based on these observations, you are giving these suggestions. So all these become irrelevant, and the relevance will relate to this one here. So you have to join this one. Edema of his ankles related to here, edema. Okay. Right. So here might help the edema. Gentle diuresis might help the edema. So it becomes relevant. So what edema of his ankles? So this edema as his ankles, some pitting edema of his ankles, this part, only take this information from here. Some pitting, this one, this information only you take. And you have to join with this one and you have to, so this is eliminated. This will go into here. This will merge with this one. So this point, patient appears to be central. So as I'm pitting edema of his ankles, this one, this point will go and merge with this one, this edema. So already it is told here. So you need not tell here. Okay. So here it is already told. So you need not tell this one. So this becomes irrelevant. So you need not merge here. This will go here. Might help. So edema is a problem here. So to solve that problem. So problem we don't want, solution to the problem. Here you add that point. This point you can add here. Ankles might help the edema of the ankles. Okay. So next one. Annual influenza vaccination should be recommended and pneumonia vaccination should be given. Yeah. The next one. Antibiotics might be kept at home for infective exacerbations. Okay. Exacerbation. Infective exacerbations. The next one. A weight reducing diet should be started. Weight reducing diet should be started. Why? This is the weight. 100 kg. Loss minimals. So this is irrelevant here. This is irrelevant here. This weight. So here remove and put it here. Okay. So a weight reduction diet should be started because currently he is 100 kilograms weight. So here you can add, you remove from here. I'm showing you how to remove from where and put it where. Okay. Yeah. 100 kg. Is weighing 100 kg. Lost minimal weight, minimum, irrecognized, very small weight, minor weight. So loss. Too much loss should be there now. 100 kg is still. Now still weighs 100 kg. That is what patient is overweight. So this also you can eliminate. And you can write, because you are already using here. Nah? You are already using here. Weight reducing diet should be started because of, okay. So you can add here the point. Otherwise, you can add only about weight here and a diet here. So, right? Weight reducing diet means weight reduction. This weight reduction is coming here because he is 100 kgs. This also. So this becomes redundant here. Patient is overweight. That is what it is. 100 kgs, that is overweight. Little minimal loss. So now more. Okay, weight reducing diet should be started. So why? Because of his condition. So either write half there and half here, or remove there and write here fully. So think reasonably how you are presenting. Both are okay. Both the ways are okay. It's not necessary that you have to write here only everything. So what is read there? Avoid that one. Weight reducing diet should be commenced. Okay. Next one. If he has the motivation to continue exercise, pulmonary rehabilitation program has been shown to increase exercise tolerance. That is what it is. Poor chest expansion. Okay. Inspiratory crackles, all these things. So if you make them irrelevant here, you can focus on this one. Okay, pulmonary rehabilitation program. So if you mention here, right, in a minute way, and you can add here in an expanded way. Continue exercising, then a pulmonary rehabilitation program has been shown to increase exercise tolerance by around 20%. 1/5, and to improve quality of life. Okay, lifestyle enhancement. Quality of life is lifestyle. Okay, improvement, enhancement, lifestyle modification, enhancement, lifestyle modification, exercise tolerance, increased exercise tolerance. So for that one, we have to give pulmonary rehabilitation program. That is related to this one. Chest expansion, these 2 points, last 2 points. Right. So I hope you are clear with these points. So relevance and irrelevance and which paragraph what will go. Right. So got a good idea of relevant and irrelevant information. So now we'll move on to how to write the sentences. Sentence construction. Okay. Shall we move on to sentence constructions? So yes or no? Yeah. I'll give you how to write sentences. Introduction I have already given you. Now based on the introduction, I'll give you the conclusion. So here introduction I gave, Mr. Mason was diagnosed with right side. So there only I'll give you conclusion also. Right. So conclusion we can write like this. Based. So now let us take this one. Based on the aforementioned circumstances, okay, based on the aforementioned circumstances, what are the points here? Pulmonary rehabilitation program. Pulmonary rehabilitation, this you cannot change, okay. Pulmonary rehabilitation program. So already it is told, you have to change it one, okay. Program. Implementing the suggestions based on the aforementioned circumstances. Yeah. Implementing the recommendations. Implementing the recommendations. Okay. Then next one, weight reduction exercises. Rehabilitation program, exercises and dietary regimen. So these 3 things you can implementing the recommendations for exercise and dietary regimens. Exercise and dietary regimens. Okay. Based on the aforementioned circumstances, implementing the recommendations for exercise and dietary regimens would be profoundly beneficial. Okay. Profoundly beneficial for improving the condition of, who is this? Mr. Mason. You don't write also, it's okay. Okay. Then in case, comma, any additional information is required, we are not repeating the same words which are already here. See how to modify everything, what are there, same things we are telling here. Everything, yeah, what we have told, same things here also we are telling, but exercise and dietary regimen. Okay. Healthy dietary regimen, weight reduction, exercise. So all these things, recommendations for exercise and dietary regimens would be profoundly okay. So here we can change it now. Healthy nutrition. Nutrition. So I'm also getting doubts, you see. Yeah, correct only. Nutrition is C1 vocabulary. Use the word C1. Use the word C1. Nutrition. Use the word, powerful word. Okay. Healthy nutrition. Right. Based on the aforementioned circumstances, implementing the recommendations for exercise and dietary regimens would be profoundly beneficial for improving the condition of Mr. Mason. In case any additional information is required, please do not hesitate to contact me. This sentence will not be given marks. They will not, sorry, they will be given marks, but they will not be counted in the word count. Marks will be there. Don't think marks will not be there for this. They will not be included in 180 to 200 words. This last sentence. They will not be included. This sentence will not be included. Not included in the word count. In case any additional information is required, please do not hesitate to contact me. This will not be included. Okay. In case any additional information is deemed extremely prominent or relevant, please do not hesitate to contact me. So this last sentence, this particular sentence, okay, this particular sentence, you will not get the word count. They will not be included. So don't think that add these words and it has become 180 words. This sentence, this particular sentence, based on the aforementioned circumstance, that will be included. But this will not be included. You have to exclude from the word count. Okay, you have to exclude this sentence from the word count. So first paragraph, complete. Second paragraph, third paragraph, fourth paragraph, and fifth paragraph, this first sentence only. Second sentence will not be included in the word count. So 180 words only till here, till Mason. So be careful. But marks will be there for this also. Marks will be there for address. Marks will be there for everything, salutation. Marks will be there for everything. Okay. Don't think that marks will not be there. Word count only these 4 paragraphs. Fifth paragraph, first sentence. But other words will not be counted. So 180 to 200 words. This includes first paragraph, second paragraph, third paragraph, 4 paragraphs, all the words, plus fifth paragraph, only first sentence. This in case or please contact me if you require any information. Anything, however you write, this last sentence will not be counted in the word count. Remember that. Okay. So now we'll go to the body paragraph. So concept clear regarding word count. Word count. What I told you, I'll tell you a lot of things. Word count 180 to 200. Sahaya Vinoka. Why is your mic on? Yeah. So, my question is, word count 180 to 200 words. Do you understand what are the words counted and what are the words not counted? Do you know? Clarity achieved, yes or no? Come on, give me answers. Lot of things I'm explaining. I'm not just mad to go on teaching whether you without knowing whether you understood or not. Students have started asking me, sir, explain this, sir, explain this. This is difficult one. Very good. I appreciate these students. I want students to ask like this. Yeah, very good. Thank you for the information. I like it. So now moving to the main paragraph. Main body paragraph. Main body paragraphs. Okay. Now let us see. The most important thing is the body paragraph 3. Okay. Main body paragraph 3. Main body paragraph 3. Main body paragraph 3 is this. This is the most important paragraph here because this is a referral letter. Okay, post discharge, follow-up action plan. This is very, very important. This is post discharge, we call it. Post discharge. Post discharge. Right. Yeah. Right. Now, this is upon discharge paragraph. Upon discharge. So, now you have to write this one in one paragraph. This A, B, C, D, E, F, 6 paragraphs relating to these observations. These observations. This plus this. Eliminate repeated things here and write here everything. This is the most important. You have to keep in mind what is going where. So, now I want you to write AA. Sentence AA. Somebody is there in the waiting room. Kawaljeet Kaur. Kawaljeet Kaur. Okay. I permit her. Yeah. Kawaljeet Kaur. Okay. 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 Right. Now let us see. I think I have already given you these things. So why don't I give you this work? Now I want to ask you, yeah. So now can you write this letter? Can you write this letter? I have given you 90% of the information. Now, can you write this letter? All of you, come on. And I'll correct your letters. Because if I explain everything, then I think I will hinder your progress. I'll not make you think anything. Everything I do, then you are going to write the exam. So I should give your mind also. Okay. Yeah, I'll send you the question paper. I'll send you the question paper. Yeah, I'll correct your questions. Yeah, very good. I love the answer. I love the response. I love the readiness. Yes. So let us take this as a today's work, today's writing task. Okay. Shall we do one letter every other day like this? You select one difficult letter and give me, and I will explain this letter like this. So shall we do weekly 2 letters or 3 letters? You tell me. Weekly one, okay. Weekly lecture like this. I mean, weekly lecture like this. Okay. 1 lecture or 2 lectures or 3 lectures. Weekly, how many shall we take? You give me your choice. One already we have told this one from next week onwards. Yeah. Majority vote. And if you tell these are difficult, then those only will discuss. Come on, come on, come on, fast. 2 or 3, 2 or 3. One, two, three. 2, 2, 2, 3, 3, 3. Yeah, come on. Others. Okay, 4, 4. Okay. So 5 and 4. Okay. 9 students again. What about the rest? Come on. Manjula, count how many twos. Pranita, count how many threes. Yeah. Okay. So let us see. Let us take 1 week 2 letters and 1 week 3 letters. Okay, like that one. 6 threes. Okay. No problem. 1 week we'll take 2. Okay, this week we'll take 2. Next week we'll take 3. So already I told yeah. This week 2 letters. 1 letter is over. Next week 3 letters. Yeah, we are doing justice there. So out of 15 days, we'll take 5 letters. That means every 3 days, 1 letter we can take. Fine, that's okay. So are you happy with this session? Okay. Can you please grade this session? Okay. Are you happy with this session? Yes or no? So was it useful for you? Your usefulness is more important. I will teach all nonsense, whatever you want, but what you want is more important. Yeah, you can grade it from 0 to 100. How much beneficial it is now. So if you say 50% more beneficial, then we'll try to see the other 50 also we try to add. How much beneficial you felt? Just give your scoring. Come on, 10 seconds only. Yes. Now, last question is suggestions for improvement. Do you have any suggestions for improvement for writing task? So those who write one letter every day, their letters are being corrected. Okay. So suggestions for improvement. If you have anything, suggestions for improvement, you can give. Suggestions for improvement. Then those who are ready to write one letter every day, write your name so that I will make a note here. First name and second name. So these people will be getting one letter correction every day. When you are writing your name, that means it's a promise. Remember that. Okay. All the students who have registered your names, those who are regular subscribers, for them only. Yeah. Right. Write one letter and submit every day. So, yeah. Somebody write in a paper and send it to me, please. Somebody who will write Pranita Pamarti, write these names. Okay. What names? Pranita Pamarti, number 1. Kennedy Christian, number 2. Sahai Vinoka, number 3. Okay, no problem. I will note it down. These are the registered regular students. Pranita Pamarti, number 1. So, Pranita, you have to write one letter every day. Are you ready to write a letter every day? Kennedy Christian, number 2. Are you ready to write a letter every day? Kennedy, I'm making a promise for you. Otherwise, you will not do no everyone. I have to be behind you. Okay, Sahaya Vinoka, are you ready to submit one letter every day? Regularly, I will do it. Correct it. Correct your letters. So, Kennedy, yes, sir. Pranita, okay, sir. Sahaya Vinoka, are you ready to do? Then only I'm taking your name. Then Manjula Ravi Kumar. What about you? Number 4. Yeah. Yeah, are you ready to do? Manjula, yes. Number 4. Then next one, Meera Manoj. Number 5. Yeah, ready. Every day you have to do one letter. Yeah, you are writing every day one letter. I know that. Next one is, but still say yes, sir. So Meera Manoj. Next, Chaitra Gowda. Chaitra Gowda is, are you ready to do one letter every day? Chaitra Gowda, number 6. Yeah. Number 6, Chaitra Gowda. Number 7, Neha Navin Kaval. I'm sorry, Kaval, you are a guest. So number 7, Neha Navin, number 7. So once you subscribe, you can submit your letters every day and you will get the corrections. You have to subscribe for this writing course or full course. So if you are interested only to writing, you can register. Neha Navin. So 7 students have given the names. Others did not give. That's okay. Right. So that's the end of the session. Thank you very much. So select all. copy. Yeah, that's it. So before leaving, take one time. Before leaving, take 1 minute and give your feedback. Yeah, Hajarat Adayamo, you have to register for the course. Then only you will get the corrections every day. Give your feedback from the depth of your heart. Whatever you want to write, you can write. Please. What you learned or how it helped you or how was the session? It was a good session or not? What is the style of the teacher? Was it the teacher able to explain what you require? Is the information beneficial for you? All the doubts are cleared or not? Whatever you want to write, 1 minute only. Only 1 minute. Write whatever you want and then you can leave. Yeah, Adayamo, you can contact me on my number. So I'll give you my WhatsApp number. So copy link. Yeah, this is my number. You can contact me for subscriptions. Yeah, Kaval and Adayamo. You can contact me. Dorcas, new students. You can contact me because only for regular students, regular session will be there. First 2 days will be demo. Afterwards, you can register. So after 2 days, you will not get entry. So only those students who are registered will get the entry. Yes, that's the end of the session. Good night. Have a nice day. Bye bye.